Right, mobility and coordination. We'll talk about this mobility and coordination within prion disease.
Sorry.
All right, that's okay. So if we talk about some of the movement disorders within prion disease, before we actually talk about how you as carers can assist and manage these conditions. If we talk a little bit about ataxia, what is ataxia? Well, it's a lack of muscle coordination, which affects walking, speaking clearly, swallowing, and other activities that require some of the fine motor control, such as writing. Myoclonus is that sort of sudden, brief, involuntary jerking of a muscle or even a group of muscles. And the exaggerated startle reflex. And when someone has this exaggerated startle reflex, you might often see he or hear us talking about this startle reflex. And the patient may look really fearful and may actually recoil from touch, sound, or when someone approaches. But we're anxious to reassure you it's actually a reflex, it's not an emotion. And the reason I mention these things is you might hear your healthcare worker or your doctor actually mentioning these words, ataxia, myoclonus, and an exaggerated startle reflex. And it's just so that you understand what these words mean. Okay, Phil, thanks. So when we're talking about managing ataxia, again, a referral to the occupational therapist for assistance with aids and adaptations. A referral to SALT, you might hear us talking about SALT. What we mean by that is a speech and language therapist. But don't rush your loved one. Ataxia can be really frustrating and debilitating. You can start by just using clothing that's simple to wear. No buttons and no zips, as I mentioned before. Try and use cups with lids and finger foods, sandwiches, easy to eat foods. It just makes life a little bit easier for them when they can't manage to pick things up or they're starting to spill things. And again, we're talking about in the early stages of this condition, just to make life a little bit easier. Some of this, simple solutions that you might just not have considered are the easiest. So don't rush and take your time achieving goals and completing tasks. Just to slow things down. Try and avoid flashing lights to avoid the startle reflex. Avoid sudden noises like banging doors, shouting, phones ringing, turn the volume down on your ringtone. And try and avoid approaching someone from behind. Try and speak quietly to them and let them know that you're there before you actually confront them. It's a good idea to take care when you're feeding the person, as they may startle when food and drink is moving towards them. And just be aware that they may startle so that you don't startle as well as when they startle. And as I said before, use closed lid cups, or sometimes a sports bottle, and that gives them that little bit more independence before you have to start feeding the person. It's a good idea if they're sitting on the chair themselves, just to keep things like the remote, the telephone, a call bell, all within easy reaching distance, because they might struggle when they've got ataxia to reach things quite easily because their arm movements aren't that well controlled. And the most important thing that I can ask you to do is to reduce as much external stimuli as you can. And by that, I mean noise, sound, changing of lights, as much as you can, just to keep things lovely and quiet for the person. Now, we're going to talk a little bit about falls prevention, and the reason for that is the biggest, I'm quite sure you're aware, the biggest risk for someone with poor mobility is a fall. So again, get a proper assessment from the occupational therapist. But what we will talk about is a few things that you guys can do. Clear all rooms of unnecessary furniture, rugs, and clutter if you can. Now, I'm not asking you all to throw things away or get rid of things, get rid of your very precious things. And if you don't have anywhere to store all these things, you know, you can rent a storage. There's loads of storage facilities that you can use to rent, but try and clear them of as much clutter as you can. Try and ensure there's as much good lighting around as possible, because people's vision starts to go as well. Good fitting footwear is really, really important. Can't stress the importance of that enough. Shoes are often better than slippers, even indoors, good fitting shoes. Non-slip mats in the bathroom goes along with not having any rugs in the sitting room. Be aware of why the person might be restless and try and address that. Phil touched on that a little bit earlier. Are they thirsty? Are they hungry? Are they bored? Do they need the toilet? So they can stop, you can prevent unnecessary wandering about. Ensure the furniture's at a good height for getting up and down. You can talk to the, you can talk to the occupational therapist about getting seat raisers for your furniture. Just make sure they're on a chair that's the right height. You can get sensor pads for either on the chair that they're sitting on the floor, or on the doors. Again, talk to your occupational therapist about things like that. Adaptations in equipment such as grab rails, riser recliner chairs, wheelchair, walking aids, all make life much more easier for your loved one and for yourself, which is why you really need to get a proper assessment from your occupational therapist, not just once, but get reviews constantly. And if you haven't had a review recently, talk to the nurse that's involved. That could be myself, Phil, Blair, any nurse that's involved. Phil, thanks. So, movement disorders are complex, which, if severe, may need pharmaceutical intervention. And this needs to be discussed with your clinician, and it's not something that we're going to discuss tonight. They're debilitating and frustrating for the patient and the carer. People with movement disorders are at extremely higher risk of falls. Simple precautions that I've mentioned can reduce this risk greatly. There are simple available aids and adaptations from appropriate professionals that can make your life easier for the person with movement disorders. So seek help as soon as possible. Thanks.